Good morning. Welcome to the YouTube channel Skepta. I am your host, Dr. Mani Iyer. I sincerely request all of you to please subscribe, like, and share this video to your family and friends so that we can produce many more such programs like this. Also, please press the bell button for notifications. At the outset, a very good morning to one and all. Thank you so much for being here. Let me start with a question. How many of you remember exactly where you were on 16th December 2012? December 16th, 2012, a young woman boards a bus home after watching a film with a friend. What happens next will grip an entire nation, trigger the largest protests India has ever seen in decades, and rewrite the country's laws within months. Today, we won't just revisit what happened. We look at it the way a psychologist does, asking what drives ordinary people to commit extraordinary harm, what happens inside a survivor's mind afterward, and why an entire country reacted the way it is. It did. Because understand the psychology behind the violence is the first step towards preventing it. So let's start where every investigation starts, right from the start. What happened on December 16th, 2012? If you're from India, odds are that odds are the date doesn't need an explanation. It's a date that stopped a nation on its tracks. Today we are not just going to remember it, we are going to understand it. We're going to go behind the headline, put on a psychologist lens, and ask the harder questions. Why did this happen? What does it tell us about human behavior? And what can each of us actually do about it? This is Behind the Headlines, a psychologist's psychological look at the Nirbhaya case. To analyze this case, we are joined by renowned psychologist and rehabilitation specialist, Ms. Medhavi Sati. Ms. Medhavi Sati is an RCI registered and psychologist, clinical psychologist, and holds an MPhil in rehabilitation psychology recognized by the Rehabilitation Council of India, RCI. Most recently, she completed a 6-month internship at the Composite Regional Center in Lucknow, working under India's Ministry of Social Justice and Empowerment. Alongside clinical postings at Government Medical College and Hospital, Haldwani and Sushila Tiwari Government Hospital. Last December, she presented a poster at the AIMS New Delhi National Conference on Psychogeriatrics, work exploring how high stress reshapes the mind over time. And across her training, she has worked hands on with everything from CBT and DBT to biofeedback and neuropsychological assessment. So, with this small short introduction, I herewith hand over the mic to Ms. Medhavi Sati to analyze this case for us. Over to you, Medhavi ji.
Thank you, sir, for this warm welcome. And just starting with the case, uh, before we talk about any one case, I want to hold any single person in your mind. Maybe a client you have worked with, a friend, a family member, anyone whose fear of violence quietly shapes decisions they make every single day. Where they live, when they travel, who they trust, keep that person in mind because everything we discuss today is ultimately about protecting people like them. Here's a scale of what we are dealing with. India records roughly 31,000 reported rape cases every year, and every researcher in this space will tell you that the number is a serious undercount because stigma keeps most cases from ever being reported at all. Here's a nuance that might surprise you. Most sexual violence in India happens within families or known relationships. The case we are discussing today, a stranger attack, is actually the rarer pattern. It dominates the headlines, but it's not the most common threat most people actually face. So, why does it matter to us as people who care about mental health? Because the impact never stops with one person. Survivors carry the risk of PTSD and depression and many other problems in their entire life. Families carry grief that doesn't resolve on a schedule. And society, all of us carry something quieter, a kind of collective anxiety, a shrinking of the world, especially for women. So here's the real question I want you sitting with. Why does one case become a national turning point while thousands of others never make it past a single paragraph in a newspaper? Let's find out by looking at the one that did. A quick heads up before I go further. What I'm about to share involves a real case of fatal violence. I'll keep the factual and clinical non graphic, but I wanted you to know what's coming. So, as told by Sir, this is a case of New Delhi. The date was 16th of December. She was a physiotherapy student, 22-year-old. She boarded a private bus with a male friend watching a film. The media named her Nirbhaya, meaning fearless, because Indian law protects the identity of victims. Six men were on that bus, including the driver. They attacked and severely assaulted both her and her friend. 13 days later, on 29th of December, she died of her injuries in a hospital in Singapore. Of the six men, one died in custody during the trial. One was only 17 at the time, tried under the juvenile law. He served 3 years in a reform facility and was released in 2015. The remaining four adults were convicted, sentenced to death, and after exhausting every single appeal, executed in March 2020. And here's what makes this case different from so many others. Within days, it triggered nationwide protest. Protest big enough, loud enough, sustained enough that they led directly to India's Criminal Law Amendment Act of 2013, a law that redefined rape, created fast track courts, and set a stricter sentencing. Very few cases in India have moved from public grief to actual legalization this fast. And that's exactly why it's worth studying. Not just a tragedy, but a case that teaches us something about psychology, understanding the person at individual level, group level, societal level, and many other. So,
Yeah,
uh,
ma'am. Yeah, you've given a nice introduction of the case study. So, I would appreciate if you could give a psychological profile of the case. If you do a psychological profile of the case, particularly the victim and the perpetrators and the circumstances under which this happened.
sure, sir. So, let's start with the person at the center of this. Because how we talk about victims matters just as much as what we say about the perpetrator. She was 22, a physiotherapy student. That night wasn't remarkable in any way. She would simply watch a film with a friend, was heading home, that's it. The entire thing is why her. She was in the place at a time and nothing more. I want to underline that because Psychological profiling of a victim is never about finding what she did was wrong. It's about understanding the vulnerability created by the circumstance, not the character, not the choices, not the blame. Now, the setting itself. A private bus, no passengers, late at night. This is a textbook combination of isolation factors. No witness, no way for her to call for help, nowhere to go. Add anonymity and a group with harmful intent, and you have one of the most dangerous combination in the psychology of violence. And that combination, isolation plus a group, is exactly what we are going to unpack next. Talking about the perpetrator. Now, let's turn to the six men involved because there is where some of the most important psychological lessons live. Their ages range from 17 to 33. Mixed backgrounds, several had limited education and were living with real economic hardship. I say this not to excuse anything, but because understanding context is how we eventually prevent the next case, not just punish this one. Here's something worth sitting with. In a later interview, one of the convicted men said that a woman out at night shares responsibility for what happens to her. Let that sink in for a second. That's not an isolated extreme opinion. It's called moral disengagement. Moral disengagement, it's a kind of defense mechanism. Blaming the victim protects the offender from having to face the full weight of what he did. And then there's the case that split the country's opinion right down the middle. One of the six was 17 years old, tried separately under the juvenile law. Here's psychology behind the distinction. The prefrontal cortex, the part of the brain that is responsible for impulse control and weighing consequences, isn't fully developed until your mid 20s. That is not an excuse for what happened, but it is exactly why age matters so much in how the justice system and we as clinicians think about accountability versus rehabilitation. It's a debate this case reignited across the entire country, and it's one we are still having today.
Thank you very much, ma'am, for the psychological profile of the case, including the the victim and the perpetrators, and the circumstances under which this happened. Now, we would like to turn to if what would be what are the psychological perspectives or inferences that we could draw from this case? If you could shed some light on that, that would be great.
Yes, sure, sir. Uh, I mean, why groups do what individuals wouldn't? So now the question everyone in this room is probably asking, how? How do six ordinary human beings end up doing something like this? Psychology actually has a name for part of the answer, that is de-individualization. When people act as a part of a group, especially somewhere anonymous, like a moving vehicle at night, each person's sense of individual accountability drops. The group starts to feel like permission. Nobody feels fully responsible because everybody is sharing the weight, or so it feels to them. Second, and this one matters a lot, these attitude towards women weren't something these men were born with. They were learned from the environment, from upbringing, from years of normalized ideas about what women are allowed to do. And here's the hopeful flip side of that. If something is learned, it can also be unlearned. That's literally the foundation of every prevention program that works. And third, moral disengagement. That was talked before, which we just touched on. Shifting blame onto the victim isn't logic, it's a psychological shield. It lets a person live with themselves after doing something unlivable.
Yeah, what about the trauma, grief, and the response, collective response? If you could shed some light on that.
Trauma, definitely, will turn from the offenders to everyone else this case touched. Because trauma never stays contained to one person. I mean, the friend who survived that night carries something we don't talk about enough: survivor's guilt. Complex trauma doesn't only belong to people who die from violence, it belongs just as much to the people who've lived through it. And then there's her mother, Asha Devi, who became a long running public advocate for justice reform. Psychologically, this is what we call post traumatic growth, finding meaning and purpose through grief rather than being consumed by it. This is also what we have seen in the case of Arjikar victim, that her mother was, uh, you know, got into power in politics. And this is the same, that is post traumatic growth. If we find the meaning and purpose through grief, it's real and it's documented. And it's a powerful counterexample to the idea that grief only ever looks like collapse. And finally, zoom out to the entire country. The scale of protest we saw wasn't chaos, it was healthy collective processing. A society choosing to face shared trauma together instead of looking away. The way so many other cases quietly get looked past and notice something else. Stranger, urban, newsworthy cases like this get amplified by the media, while far more common cases, the ones happening within families, stay invisible. That's not an accident. That's the availability heuristic at work. The more vivid something is in our memory, the more it distorts our sense of it actually dangerous. Now, I as a clinician, I get to see cases who get, mostly happen within families, abuses that happens within families, and how they shape the person as a person. What kind of trauma, what kind of personality, pathological personality develops in that person. So now we understand the mechanisms. The harder question is, what do we actually do with that understanding? Let's talk prevention.
Thank you, ma'am. Thank you for the psychological perspectives and inferences and your comments. They were very valuable. Now, turning to how we can prevent such things from happening in the future, as well as what takeaways we can take from this case. And if there are some people suffering, I mean, if there is anything that may happen like this in the future, how they can reach out, etc. What are the reach out mechanisms? To shed some light on that, I would like you to discuss this.
Sure, sir. Now, this is where we shift the gears from understanding to action. Because everyone in this room can walk out of here today with something real to do. First, if you ever witness something happening in front of you, remember the 5 Ds: distract, that is, create a diversion; delegate, that is, get someone else involved; document, that is, record from a safe distance. If you can do so safely. Next, delay. Check in with the person afterward, even if you couldn't act in the moment. And direct. Step in directly, but only if it's actually safe to do so. Second, if someone confides in you, a friend, a client, a family member, anyone, here's what actually helps. Believe them. Believe them and say so plainly out loud. Listen without demanding every detail. You don't need the full story to offer support. Avoid any question that starts with why didn't you? Even asked gently, it implies blame. Help them find professional help rather than trying to be their only source of help. That's not selfishness, that's smart care. And if you work with young people in any capacity, start gender attitude education early. It works dramatically better in adolescence than it does trying to shift attitudes in adulthood.
Thank you, ma'am. So that is that was very well said, and we have a lot to work for. And also, we would like to talk about some systemic changes that can be, changes, and where do these people reach out uh, in such circumstances?
Yes, it is very important to talk about what changed at systematic level because individual action isn't the whole story. This case is led directly to the Criminal Law Amendment Act of 2013, redefining rape, creating first track courts, setting far stricter sentencing, and the creation of Nirbhaya Fund, which still supports women's safety infrastructure today. That's collective grief turning into structural change in real time in front of an entire watching nation. And before we move to closing, a practical moment. If you or someone you know ever needs help, please remember these. The Women Helpline in India is 181. The police emergency is 100 or 112. The National Commission for Women can be reached at 7827 170170. Childline for any under 18 is 1098. And always a licensed clinical or rehabilitation psychologist should be a part of ongoing trauma support, not a replacement for these emergency lines, but the next step after the immediate crisis passes.
Okay, ma'am. And so that was a very useful thing that just mentioned. And everybody should have this ready reckoner right in front of them always. They have to carry with them so that anytime they get trapped into any kind of situation, they have to immediately reach out. So now we have almost come to the end of the discussion. So we would like to conclude, and in conclusion, what are your reflections at this thing, and how would you summarize this?
Yeah. Coming to the end of all this, violence like this sits at the intersection of individual psychological group dynamics, developmental factors, the way the person is born, brought up, his childhood, his surroundings, and the social conditioning that he is or she has been with. No single lens explains it, which means, importantly, no single fix prevents it either. Prevention works in layers, bystander skill. That means, when in like road rages you will find, or in like road accidents you will find when a person who is, you know, uh, who got into an accident, the people around them will, gather there, and not a single person will step out because they are seeing each other. That's the bystand. They are seeing each other and waiting for the response from the other person. Until and unless the other person just go by, they will stand there. So someone need to take the first step. So that's where the prevention begins. Trauma informed support. What after the trauma is being done, after the situation is being done, how to manage it, where to go to for help. Community education. Where are these people born? The perpetrators. What are they conditioning? So community education is really important. Policy change. Every case like Nirbhaya case will bring a single policy change, will help the entire country. And here's the thing. Everyone in this room already has a role in at least one of those layers. Whether you're a parent, you're an educator, you're a clinician, or simply someone who walks through the world paying attention. Recovery, too, isn't only about treating pain after the fact. Sometimes our job, and every one of your jobs, in whatever capacity you show up in someone's life, is to help someone find where that pain can go. Asha Devi didn't just survive her grief, she turned it into a fight for other people's daughter. That's not the only healthy response to trauma, but it's real, it's powerful one and worth remembering. So before we open the floor, I want to leave you with one question. Where do you have the most leverage? As a family member, a bystander, an educator, or a professional? Then take one action from today and carry it back to your own community this week. Not someday, this week.
Thank you very much, ma'am, for that. It was a very difficult topic to start with, and you have taken the lots of effort. You have put in a lot of effort to put together this presentation and this talk, and really it was very nice, very good, and very, you know, very put in a very sophisticated way, so that we don't we whatever takeaways are there, we will be able to take away and prevent such things from happening. So thank you so much. I really appreciate, and everyone here would like to thank you as well. So we all thank you for having not taken up this topic and come up with such a very sophisticated and very useful talk. So now. So we have come to the end of the program. So I would like to take leave. We would like to take leave, and we would like to see you in other many more programs that are to come, hopefully very soon. So thank you very much, G. Thanks a lot. I really appreciate it. That was really
Thank you.
awesome. Awesome. Thank you so much. Good
Thank
day
you
to
for
you.
providing the
And
opportunity. Thank you.
yeah, and we'll see you very soon on our
Sure.
platform. Thank you very much.
Thank you, sir.
Good day.